Okay, Hare Krishna, welcome everybody to our reading club every Sunday. We are going to continue reading. We can read between I can start and then somebody else can read. And we are going to leave the last minutes just to we can, if any of you have any questions or concern or commentaries, we can share with it. And Sangita Mataji is here with us, so she can help us answering these questions. So let's share here so everybody can see the material. And also before we start today, let's see here. I make a reminder because we have a great workshop next week, next Saturday, March the 1st, with Sangita Mataji. It's going to be like we entitled this like well-meaning words gone wrong, what not to say to a grieving devotee. So I think will be very interesting for all of our community of Vaishnava care. So please see the information on Facebook. We have this information on our WhatsApp group also. So please join us for the next workshop. And then, okay, we're going to start here. We stop in the page 172 with this topic. Just please let me know if you can see the page here, the book. Can you see the?
We're on the chapter complementary therapies for comfort care.
Yes. Can you see the book? I'm sharing it on the.
Yes.
Yeah. Okay. Thank you. So we are going to continue cutaneous stimulation application of heat and or cold for pain management. In some circumstances, applying external heat compresses and or cold packs may decrease intensity of pain. At the very least, it can provide a distraction for your patient. Let's hear just one moment. So his pain is more tolerable. Again, these methods should never be used as a substitute for analgesics or to increase the interval between doses of medication. After each application of heat and or cold, ask the patient to evaluate its effectiveness so treatments can be continued or modified as needed. As with analgesics, non-invasive pain relief therapies is most effective when applied before the patient's pain is severe. And all these treatment therapies that Sangeeta Mataji is sharing with us here, many institutes now are using them. Like Bara Sangeeta Mataji gave that information a couple of years ago. So this is very valuable for our communities and for devotees and for people in general. So thermotherapy, heat therapy, external application of heat works by the dilating the blood vessels, so circulation to a particular area is increased. When blood circulation is increased to muscles, pain is often reduced. Application of superficial heat may increase oxygen and nutrient delivery to damaged tissue and decreased joint stiffness. An electric heating pad, moist or dried, hot water bottle or warm compress can be applied directly over the area of pain or next to, above, or below the area of pain as tolerated. Generally, it is believed that moist heat is more effective than dried heat. Electric heating pads should always be properly covered with a cloth or towel, and hot water bottles should be wrapped in a towel as well. More towels may be needed. if the patient has decreased skin sensation. Heat should never be applied to skin that has been exposed to radiation treatment. During heat applications, be sure to check the skin frequently to ensure that the patient's skin is not weathered, burnt, or blistered. This is especially important if the patient is confused, nonverbal, or unconscious. Cryotherapy, cold therapy. Cold therapy, such as the application of a cold compressed ice pack or reusable gel pack, causes blood vessels to constrict, thus decreasing circulation to the area of treatment. Vasoconstriction helps to reduce inflammation and swelling, which will often decrease a patient's pain. Cold packs also relieve headaches and joint pain caused by immobility, as well as muscle sprain or spasm. To be sure, the the intensity of the cold therapy is tolerable. It is recommended to place crushed ice in a well-sealed plastic bag and then wrap the bag in a towel or pillowcase. Ice packs should be flexible to conform to the patient's body contour. The patient should be keep warm with sufficient blankets during the cold therapy so she does not develop a chill. The application of cold therapy should be less than that of a heat therapy, less than 15 minutes. As with heat therapy, cold therapy should never be applied to skin that has been exposed to radiation therapy. Similarly, it is not recommended for application to areas with poor blood supply. Somebody else would like to read ice massage?
I can read for a little bit.
Okay, thank you.
Ice massage. A small paper cup can be completely filled with water and placed in a freezer until solid. The, the ice will freeze slightly above the rim of the cup and will provide a smooth surface for a comfortable massage. Place towels on both sides of the patient to catch any melting ice during the treatment. Apply the ice massager directly to the skin over soft tissue using small circular motions. This should be done for approximately 5 to 10 minutes or as tolerated by the patient. Ice massage should be stopped when the patient feels the area has become numb, exposing only the area being treated. Be sure the patient is sufficiently covered with blankets during an ice massage. Contrast therapy. Alternating applications of heat and cold every few minutes to an affected area is known as contrast therapy. Of the two, heat or cold therapy is believed to decrease pain faster and to have a longer lasting effect than heat therapy. Contrast therapy, however, often works better than either one alone. It can be effective in reducing swelling, decreasing congestion, and improving organ function.
So, in other words, if you do, cold therapy, put, an ice pack on where the pain is, and then do it for like 20 minutes to a half hour, and then you switch to, heat, and then back again a half hour later to the cold, and, back and forth like that every 20 minutes to a half hour. That will be more effective than just heat or cold alone. Okay, so you want to go back and forth like that between heat and cold. Okay,
Okay.
okay, go
Thank you.
ahead.
Therapeutic massage for the terminally ill patient. Does somebody else want to read, or should I keep going?
Oh, sorry. Yeah, you can keep going. Like, we'll put here bigger
A gentle
page.
back rub can increase relaxation and ease the aches and pains associated with immobility. A slow 3-minute back rub can decrease heart rate and blood pressure, indicating relaxation. In one study, therapeutic massage was shown to be a beneficial nursing intervention that promotes relaxation and alleviates the perception of pain and anxiety in some cancer patients. A mild massage can increase superficial circulation to the area of treatment. As muscles are rubbed, blood return to the heart increases. Toxins such as lactic acid are removed from the muscle tissue and excreted from the body. Massage also has a sedative effect on the nervous system, reduces some types of swelling, and increases peristalsis, intestinal movement, thereby aiding digestion and decreasing constipation. When done correctly, therapeutic massage is said to trigger the release of endorphins in the brain that produce natural pain relievers by binding to opiate receptor sites involved in pain perception. Although this action may increase one's threshold of pain, massage therapy should never be used as a substitute for the patient's routine analgesics. Massage therapy is contradicted in areas where patients have varicose veins, blood clots, phlebitis, inflammation of the vein, open wounds, bruises, broken bones, cysts, or skin that was exposed to radiation therapy.
Okay,
All,
everybody get this. This is really important. You don't want to massage where somebody has a blood clot. Let's say when I was 19 years old, I was a pujari in the Los Angeles temple. I had a lot of pain in the calf of my left leg. It was throbbing beyond belief. I couldn't believe how painful it was. I went to a naturopathy doctor, and he looked into the my eyes and read the spokes in my eyes. It's called iridology, and it's a natural way to diagnose someone. And he said I had a clot in my leg, in my calf. I was on the altar one day, 19 years old, and the clot went from my leg all the way up to my lungs. And then later, years and years and years later, it said it also went into my brain. So, my frontal brain. So, like the forehead. So, I ran off the altar. I was not a nurse then. I didn't know what was happening, but I felt that I couldn't breathe. I was short of breath. So I knew something was going on, but I didn't quite know what. But I've had since then I became a nurse, and I have had two patients die from this in the shower. The clot went from their leg to their lung, and they dropped dead in the shower. It was awful. So I could have died on the altar, but Krishna spared me. And so it would have been great if I had, but I didn't. And so I wound up in the UCLA Medical Center for almost a month. And they said, you almost died. And I'm like, uh-huh. Well, can you hand me that bead bag over there? And I just chanted all day in the hospital and for almost a month. And so yeah, so it can be very dangerous. But if you massage, let's say somebody had massaged my leg with the clot in it, it would probably have broken off the clot and traveled to my heart or my lungs or the brain, and I could have died. So you want to be very, very careful. Never massage an area that where somebody has a blood clot. Um, and because it can break off and go to the heart, lungs, brain, and kill somebody. You don't want to do that. You don't want to, phlebitis means inflammation of the vein. You don't want to massage that. You want to make sure that you have the person's doctor or nurse say that it's okay that you can massage them. Okay, there's a lot that can go wrong when you massage an open wound or a bruise or a broken bone. a cyst or skin that's been radiated. Let's say that person that had radiation for cancer, and the skin tends to get burned with radiation. It can get very red and sore. You don't want to massage someone's skin when it's radiated. Okay. Um, Make sure you don't massage that, or it will really hurt the patient. Okay, so
Mhm.
just make sure. All right.
Okay.
It's even if you lightly massage someone, it could cause problems. Okay, so make sure you get it checked out with the hospice nurse or the doctor. Okay, all right.
Okay.
You
Thank you,
want to continue?
thank you, dear Sangeeta much. This is a very important point, and
Yeah,
I have
yeah.
an own experience that later I can comment if we have some time about that. And
It's
uh,
yeah. Can I
Karuna,
can I just say one more thing? You
yeah,
know
sure.
how I don't know if it still goes on now in the movement and RSCon movement, but I remember in the early days, devotees would be really big on cracking somebody's back or neck, you know, and I remember my god sister Govinda Dasi said to me in Hawaii when I lived in Hawaii, and she did too, and she said, I would never allow a devotee to crack my neck or back or anything, because this is why chiropractors go to school for 5 years. Okay. All right. You never allow an amateur to crack a bone in your body. Please don't do it. All right. This is why they go to school for 5 years. It's not something that you take lightly. Oh, okay, you got a headache, your neck stiff, okay. And then before you know it, they're cracking your neck. Don't do it. All right, go to a real
It,
chiropractor, just like you wouldn't let somebody stick a bunch of needles in your body because they want to be an acupuncturist. They read a book on it and now they want to stick needles in you. No. Okay, you have to go to school to be an acupuncturist, and don't let somebody read a book and do it to you. Okay? This isn't how this, we can't do this, all right?
All
So
right.
be very careful who massages you, let them become a massage therapist and do it correctly. Okay? All right, go ahead. Can we
Always,
continue?
always consult the patient's physician or hospice nurse before beginning massage therapy. Some medical insurance companies partially pay for treatments by licensed massage therapists. Check with your patient's insurance company to see if this applies. Some licensed massage therapists have taken additional coursework in order to better serve hospice patients. Inquire if there is one in your area. A 10-minute gentle massage to the head, neck, limbs, and back can promote relaxation and a better night's sleep for your patient. Use a lubricant that is alcohol free and does not absorb too quickly into the skin to avoid friction and skin irritation. Massage oils of various qualities can be purchased at health food stores or specialty shops, or you can combine a mixture of oils and scents just suitable to your patient's needs. Essential oils may be added to the base lubricant to include the benefits of aromatherapy along with the massage. 4 parts of unprocessed vegetable oil and 1 part almond oil and several drops of an appropriate essential oil can create a very soothing combination. Other oils that can be used as base oil include avocado, lanolin, safflower, and sunflower. According to
It's
Kriti
Shrutakirti. Shruta?
Das,
Yes, that's.
who served as Srila Prabhupada's personal servant for several years, Srila Prabhupada liked his daily massage with mustard seed oil on his body and sandalwood oil on his head.
Mm.
Sometimes Srila Prabhupada requested that the mustard oil be mixed with camphor, and occasionally he requested the mustard oil be heated. And I'm getting really hoarse. Can somebody else read a little bit?
Sure, sure. Anybody want to? Oh, Shalagram, you're here. Hare Krishna. Would you like to read?
I am here, but I'm actually on my way out the door to bring
Oh, okay.
someone to the Sunday feast. But I want to at least listen.
Okay,
But
sure.
I'm going to be driving. But
Okay.
thank you
How,
for the offer.
it's
Sorry,
okay.
Christian.
I
Okay, I can read. For added therapeutic effects, a teaspoon of the following oils can be added to the base oil as desired. Aloe vera oil is known for its skin healing properties. You just keep a little aloe vera plant on your windowsill, and then you can cut off a little arm. I hate that. But anyway, then I keep it in the refrigerator if I have one. And it's very soothing to open up a one and then use it on the um on like a burn or a cut like that, or just put it on your face at night. It's very healing and soothing. So then jojoba oil is known as an excellent skin moisturizer. Apricot kernel oil is also a very good skin moisturizer. Primrose oil is known for toning and adding vitamins to your skin. After you have chosen and mixed your massage oil, transfer it into a plastic squeeze bottle. Fill a bowl with hot water and place the bottle of mixed lubricant in the water for about 10 minutes or so. When applied, the lubricating oil is warm and soothing. Have a sheet or blanket on hand because oils tend to lower body temperature. So the person that you're massaging might become chilled, and that's not good. Remove any rings, bracelets, watches, etc. before beginning the massage so your patient's skin does not become scratched or irritated. Your hands should be clean and fingernails short. Yeah, you definitely don't want to massage anybody with long fingernails. Basic techniques. Arrange for a quiet, peaceful setting in which to give a massage. The room should be warm, dimly lit, and very quiet. The patient may prefer silence or soft chanting tape as background sound vibration. An aromatherapy candle may be lit for relaxation if oxygen therapy is not in use. Be very careful lighting a candle. You don't want to do that if the patient is on oxygen. Okay, you can blow up the house. We don't want to do that. Okay. Assist the patient into a comfortable position. If he is uncomfortable on his stomach, assist him in a side lying position with knees bent. Extend one knee slightly so knees are not touching. Okay, if the knees are rubbing up against each other when he or she is on the side lying position, you might want to put like a soft bed pillow in between the knees, and then you can also kind of position it so it's uh, between the ankles as well and the heels, so that they're not rubbing up against each other either. You know how uncomfortable that can be when the bones are kind of touching each other. A good rule of thumb is that rapid circular movements tend to stimulate the patient, while smooth, slow strokes tend to promote relaxation. Move smoothly and rhythmically. Random movements with your hands will not feel very relaxing to the patient. So even if you're not a massage therapist, you can still give a very relaxing massage to somebody. And then these are just a few options. You don't have to be a massage therapist. You can just follow these few little suggestions. So one is the 3 minute back rub, and I'm not going to read these, but you can read these over to decide which one you'd like to give. So there's the 3 minute back rub. That's option one. And then there's on page 177 in my book, there's the 3 minute back rub, which is option two. And then we have another 3-minute back rub, which is option 3. And there's just different ways how to give them. Okay. And then we have the 10-minute body massage. Okay. So there's 3 kinds of 3-minute back rubs, and then there's a 10-minute body massage. All right. Okay.
Okay, thank you, dear Sangeeta Mataji. So then we can read in our own these 3 or 4 options that you gave on your book, and then we should stop here because the next session will be so great that we can start from the beginning. Srila Prabhupada's remedies, so we can read all together next session, and we can leave the last 90 minutes just to, if any of you have any comments about the alternatives or complementary therapies that we were reading today, or any other question that is related to our book.
And you know what? I want to just mention that these Srila Prabhupada's remedies, when I first joined ISKCON movement in 1972, and then I moved to Los Angeles Temple in May of 73, one of my older god sisters handed me a bunch of papers. I think there were only 2 or 3, is stapled together, and it said Srila Prabhupada's remedies. And I took from there, I kept them for many, many years. I don't know what happened to them now, but I kept them for decades. And then I took from there anything that might be used in a hospice situation. So Prabhupada's remedies, they were all natural remedies, mostly Ayurvedic remedies. And Prabhupada knew so much about everything. So if somebody had a cold, a chest cold, I mean, look at this book, like in 178, page 178, he had 3 remedies just for a cold, you know, and for chest cold and congestion, he had 1, 2, 3. Also, he had 3 remedies, and for a headache, for sore muscles, a sore throat, he was just so amazing that he gave us for a toothache. You know, he was incredible. So I put in the book these suggestions that Prabhupada had that to help the devotees when they got sick. So these are very special because I haven't seen those papers in decades. So I wanted to include them in the book because I don't even know if they exist out there anymore. So we'll read them. We'll start reading them next week. But please refer to these if you or your family get sick with any of these ailments. Okay, because and refer the devotees to them if anybody gets these, because you want these to stay alive, because these are precious suggestions that Prabhupada gave us when sick. Okay, and so we want the next generation and every generation after that to know about Prabhupada's remedies. Okay, thank you so much. Anybody have a question or realization or any suggestions about complementary therapies for comfort care?
Thank you, dear Sangeeta Mataji. I think it's very important, these topics on these pages specifically. And then, I don't know, I was thinking that maybe we can have also a workshop about some pastimes of how Prabhupada used to have these therapies. And also, I don't know, with the devotees that we have here, we can ask them, like, if you would like to have a specific seminar or workshop, like with these specific methods, therapies. And I think it's very important because sometimes devotees don't have any social security, and we have some valuable things from, of course we have many valuable things from Prabhupada, but this is one of them, and then we should take consideration of these specific methods.
Yeah.
you know.
It's not that you can never go to a doctor okay, like a Western allopathic doctor, because sometimes those medicines can help you, you know. Um, like if you're diagnosed with a real, like, for example, okay, I have a very aggressive form of diabetes, and it's attacking many systems in my body. Diabetes can attack everywhere in your body that has nerves, even the brain. My grandmother went blind from it in her 50s, and then she died at 60 from diabetes. I'm older than that, but it's attacking so many systems in my body. It's attacked my GI system. It's attacked my hearing so that I'm going deaf from it. My grandmother went blind. I'm going deaf. Um, it can attack your heart. It can attack the brain. Anywhere where there's nerves, diabetes can attack. So and also I have stage 3 kidney failure from the diabetes. So it's killing my kidneys. So I have a lot of pain from that. So what am I supposed to do? Drink herb tea? That's not going to do it. Okay. I have to take insulin. I inject insulin every night because my body is stopping production of insulin. So I have too much sugar in my blood. So, it's like you need a key to get the insulin, you know, and it's too hard to explain. But anyway, I need insulin. So I have to take it artificially with an injection every night because my body doesn't produce enough insulin. So it's genetic. I got it from grandmom, and it's unfortunate. So um, it's a bad karma disease. It really is. It kills you slowly over many, many years. So, you just have to deal with it. You cope with it. So I would never think to drink an herbal tea or, put heat on my pancreas because that's not going to do it. Okay. So you have to be practical. Okay. Sometimes we do need an allopathic doctor. I'm sorry. I go to a very good one who's only deals with old people like me, and um, and he's also does hospice and palliative care. So he's very good and he's perfect for me. So, Krishna sent me the right doctor after many, many years of searching. So, you have to be practical. You can't. I've met so many devotees. I would never take allopathic medicine. I said, okay, let me give you a scenario. You're dying of cancer. You're in a lot of pain, and they offer you a pain medicine. Okay, what would you do? Oh, I would never, never, never. Why? Because it's toxic, they told me. It's toxic. I said, Prabhu, so is cancer. Cancer is toxic. Okay. It's a poison that invades your body and eats it up alive. Okay. That's cancer. What are you going to do? Drinking some herbal tea or taking some, whatever, it's not going to do it. It's not going to take it away, and it won't take the pain. Maybe, a heating pad. I've used magnet belts on patients, devotee patients, and they said it worked wonders. So we don't know. It could help with the pain and the discomfort, but it's certainly not going to take the cancer away. So maybe if they did a little bit of some kind of allopathic treatment, it might decrease and slow things down so they will have more time to chant Hare Krishna and pray and deal with what's happening in their life. Okay? We have to be practical. If allopathic medicine can slow the cancer a little bit, and maybe take some of the pain down, then consider it. Consider it. It's not any more toxic than the cancer. Okay? Just think about it. Think about it. Okay? That's a little food for thought. Anybody have a question or anything?
You know, I really appreciate you going into more detail on that, and I like the idea too of getting together to discuss some of these topics a little more in depth.
Mm-hmm.
I remember when I was a new devotee that with prasadam in the morning, I'm trying to remember. I vaguely remember really finely chopped ginger root that had been soaked in lemon juice with turmeric.
Yes.
You
Mm.
know, but now you're
I
hearing.
don't like any of that, but go ahead.
I didn't like it either, but now you're hearing so much about the benefits of turmeric, and
Right.
back in the 70s, that was not a thing.
No, it wasn't. But now a
Yeah,
lot of the Western pharmaceutical companies and the the even especially over the counter companies, the vitamin companies are making a lot of things with turmeric, and they're finding out a lot of benefits from it. So you're absolutely right. It's becoming the popular whatever, for a lot of reasons. It's an anti-inflammatory. So they're pushing it. It's amazing. And Prabhupada always knew the benefits of turmeric. He used to talk about it. So, yeah, he always was ahead of his time in many ways.
Many ways.
Yeah. Thank
Yes,
you for
well,
saying that.
thank you. Thank you everybody for being with us today. Was a nice meeting, one nice topic. And then just please remember to join us next Saturday in this great workshop that we are going to have with our dear Sangeeta Mataji. So you can register. You have all the information there in our um, channels on Facebook, on the WhatsApp group, and also we are going to send this recording session later today or tomorrow. So thank you so much, and beautiful day in Krishna consciousness. Thank you so much, dear Sangeeta Mataji. One more time.
Thank you. Thank
Hare
you,
Krishna.
everybody, for being here. We'll see you next week and March 1st for the webinar. We'd love to see you there. We're going to be talking about grief and what to say to people, what not to say to them, and the difference between grief and mourning and bereavement. And we'll go through a bunch of things. So we hope to see you there. Everybody have a great week. Stay warm if you're in places like where I live in Philadelphia. Yeah, so have a good week, everybody.
Hare
I
Hare
will
Krishna.
die.
Hare Krishna. All glories to Srila Prabhupada.
All regards to Srila Prabhupada.